My name is Michael Prangley. I am an audiologist with Hearing Solutions in Masonville Place in London. Basically, the idea today is I'm going to go through some of the kind of common misconceptions that I often hear in my office. It's certainly not going to be a completely exhaustive list of everything that I hear, but basically what I'll try to do is draw attention to kind of the top kind of 5 things that I typically hear in the office, and kind of what I'll also go through some technology. I'll go through 2 different devices of hearing aids and talk about like 3 different levels of technology. If there is any comments or questions at any time, do not hesitate. I will try to get to them within the process of my presentation. So first of all, I do work for Hearing Solutions. I've been here almost 4 years now. I've been an audiologist for 12 years. Hearing Solutions is the largest independently owned distributor of hearing aids in the province of Ontario. I've worked in a multitude of environments: hospital, private practice, ear, nose, and throat doctor. I've probably done more than about 30,000 audiograms over my career. And I'm loving the environment here. I think from the top down at Hearing Solutions is great. And in the last 4 years, it's been an awesome experience working with this company. So, like I mentioned, I've been practicing as an audiologist for 12 years now. I'm born and raised in London, did all my schooling here. I myself have been wearing hearing aids for almost 36 years. I was diagnosed with hearing loss when I was 4. I had pretty much a sudden sensory neural hearing loss. Basically normal hearing one day, next day the hearing was gone. So I went and immediately my parents obviously picked up on it, immediately got my hearing checked, and was fit with hearing aids within a couple weeks. And I've pretty much been wearing hearing aids ever since. So, 36 years I've had them. I've been able to try pretty much every manufacturer, every design, every style, every tech level. So from a kind of a perspective of, myself, I wear them, I sell them. I think I have a pretty good understanding over how the devices work. In this clinic, I often see, University of Western students. I'm very active in kind of the research of everything in terms of hearing aids. So I try to involve myself not only as a participant in research, but also as someone who sells the hearing aids. So it's nice to kind of have that perspective. Okay, so basically I'm going to dive into it. I apologize if this breaks up at all. We do have a dental office next door, so the walls are lead lined, so we sometimes don't always get a good consistent signal. So hopefully everything will go through okay. So the main thing, the first thing that I typically notice with people when they come in, if I get hearing aids, everyone is going to see them. So, obviously there is some issues with cosmetics, and people want to make sure that, they get something that is, that's comfortable, that's invisible. They want to get something that no one's gonna be able to see. So a big concern a lot of people have is, if I get hearing aids, everyone's gonna see them. Typically at that point, I often will kind of turn my head and say, what did you think of the hearing aids that I'm wearing in my ear right now? And then I often get this puzzled look on their face, and I turn my head to the side and I take my hearing aid off, and they're like, I didn't even know you were even wearing hearing aids. And I'm like, well, kind of exactly. That's to my point, that you didn't really notice them, you weren't expecting to see them, and I was able to carry on in the conversation without any difficulties. So people often, will say, my mom had a hearing aid, or my grandmother had a hearing aid, and it was this big and bulky, and it was clunky, and it whistled all the time. So the difficulty there is, that's hearing aids from, 20, 25, 30 years ago. Like, you don't drive your grandmother's car, you don't watch your grandmom or grandparents' TV. As technology has gotten better, the miniaturization of televisions, cars have gotten smaller, more sophisticated, hearing aids have gotten smaller and much more sophisticated. So a lot of people still have that idea in their head that, hearing aids need to be are big and bulky. They're not. They're inconspicuous. I've got no hair hiding my hearing aids, and again, 90% of people who come into my clinic do not know that I've got a hearing aid in my ear until I point it out. So I certainly get that, cosmetics is important. It's something that we absolutely would work through with you for sure. A quote that I often use in my clinical environment is, you are more noticeable with hearing loss than you are with hearing aids. So once you have hearing aids in your ears, you feel more active, you feel more involved, you feel like you're not missing parts of the conversation, you feel like you're involved the way that you want to be. When you don't have your hearing aids in, or you don't have hearing aids at all, to me, I would say you're more noticeable to that effect, because you're disengaged from the conversation. You're not actively responding to what people are saying. You're withdrawing socially, or you're doing the nod and smile, and people pick up on that pretty quickly. So I would say, yes, you're more noticeable when you can't hear than when you can. So definitely it's something you'd want to talk to your clinician about. If you want something that is small and inconspicuous, definitely something that we can work through with you. And I will provide at the end of the session a couple of different designs of hearing aids, so you can kind of see essentially what they look like and what you could potentially getting into. Next up, number 2, only old people wear hearing aids. And this is something that I hear all of the time. There seems to be a stigma attached that, the elderly population are the only ones who actually wear hearing aids. And that's, a larger percentage of the elderly population will wear hearing aids more than someone in their 20s or 30s, of course. But I myself am an active case where I've worn hearing aids since I was 4 years old. I used to work with the infant hearing program prior to coming with Hearing Solutions, and I was fitting hearing aids on babies as young as 6 months. So it's not an age thing; it's a need thing. As we age, we do lose our hearing, but that can start at any time. Like in this environment, I test a number of Western and Fanshawe students. I do a lot of kind of testing for the police college. I see people coming in who are 20 years old. They think their hearing is perfectly normal, but they're just getting this test done because they have to. And I test their hearing, and their hearing is normal or within the borderline range. Then when we do testing in background noise, all of a sudden their results start to drop off a little bit. They're like, oh, I'm not hearing in clearly as well in background noise as I should. So they still are within the normal limits at that age, but there already has been some degradation of the kind of how their ear and brain is processing that sound, and it's nothing they never really would have picked up on until they came in and got this testing done. So yes, as we age, the higher percentage of people, it does increase that has a level of loss, but at any age, anybody can be diagnosed. All the research has basically shown that the sooner somebody adapts and gets hearing aids when they notice they have hearing loss, kind of the better their long-term prognosis is going to be. One of our manufacturers, one of our last things was our conferences was telling us that the average person takes 7 to 10 years from the time that they do anything, from the time they notice a loss before they do anything about it. So if a person comes in and gets tested at 65 but recognizes that they had hearing loss at 55, it's going to be something that they should have done something about it a little bit sooner. But it's one of those things that, when you're ready, come in and do it, but it never hurts to get a baseline measure done. One stat that I pulled from it is an American stat, but they said more than 40% of the 48 million Americans who have hearing loss is under the age of 60. So it just shows that a pretty good percentage of the population, even under the age of 60, has some type of diagnosed hearing loss. So if there's any suspicions of there is any type of loss, come in. It's better to find out at a younger age. Typically people wouldn't think twice. If you were told in your 20s you needed glasses, you would go and get glasses because that's something that you need. So same thing with hearing loss. If we diagnose hearing loss and you're ready to do it, it's something that we should do. So that was number 2. Only old people wear hearing aids. Number 1, if I get hearing aids, everyone's going to notice them. Number 3, and this is one that I heard earlier in the clinic today. I can hear fine. It's my spouse or my friends who say that I can't hear. And that in some ways is true. Both individuals, are probably noticing some type of difficulty. The person themselves who has the loss probably realizes they're not hearing as well as they should be, but if they're able to see the person when they talk, if they turn the television volume up, if they move into closer to other people, a little bit more difficult to do that now because we've got to keep our social distancing, but people are starting to notice, oh, okay, I'm able to hear some things, but I can get by. It's not a big deal. So the significant other typically notices. What I hear from most people is, and I start to kind of press them a little bit and talk to them is, yeah, I can tell that people are talking, but I just don't hear clearly what it is that they're saying. But that's probably they're mumbling, they're not speaking clearly, or they're talking to the wall when they talk to me. So kind of the onus of control is not necessarily on them. It's other people are not speaking clearly, or they speak too fast, and that may be part of it. But the difficulty is what they call presbycusic hearing loss, or kind of age-related loss. That type of loss is typically, I can hear better in what we call the low frequencies. So low frequencies of speech are your vowel sounds. They're the power of speech. The high frequencies are typically your consonants, or the clarity parts of speech. So I can tell that people are talking, but I can't hear clearly what it is that they're saying. If you're not able to hear clearly what people are saying, yeah, you can hear that they're talking, but you're not getting the understanding. Was that an F or an S? Or was that a TH or an SH? I don't really know, so I'm just going to answer what I thought I heard, and sometimes that's going to be correct, and sometimes that's not going to be incorrect. And I think we've all kind of been in that situation for sure. The hearing aids nowadays are designed specifically for those types of environments where, okay, I hear low frequencies okay, I don't hear high frequencies very well. The hearing aids can be individually adjusted to each of those frequencies to bring those ones you're not able to hear back into a normal range while kind of leaving the other sounds alone. So something definitely to talk to your healthcare professional, your hearing healthcare professional about. If you've got some type of loss or you're thinking you're not hearing things clearly, definitely go in and get checked. So that was number 3. I hear fine, but everybody else that's the problem. It's not me. The fourth one, this was one that I heard actually twice last week, was my family doctor, my friend, or my family member said I only need to get one hearing aid. So although I may have hearing loss in both ears, I'm just going to get one hearing aid. Okay, yes, I personally agree that, you're better to have one hearing aid than you are to have no hearing aids. That at least is going to improve your hearing a little bit. But in terms of being able to hear, localizing where sounds are coming from, being able to hear in crowds or background noise, providing acoustic enhancement not only to the one ear or to both ears, and being able to hear in stereo, you're going to hear better when you are hearing sounds through both ears. Your brain responds to sound from both ears. That's why you have 2 ears, because your brain relies on speech information coming in from both sides. If you're only amplified on, this would be my left ear. If I've got sound coming in this side and I'm wearing a hearing aid in this ear, but the sound actually occurs from over on the other side, I'm going to instinctively turn in the direction where I thought the sound was louder, and that may not be where the sound's actually coming from. During COVID, I ran into an issue where one of my hearing aids had to go in for repair, and I didn't have a backup at the time because I wasn't in the office. My son was yelling about something in the basement, so I ran downstairs going to look for him. Well, he was actually upstairs in his room. So because I only had the one hearing aid in, I could have sworn he was in the basement, and I went down there to look for him, but he was actually up on the other level in his room, but I was completely confused as to where the sound was coming from because I just had the one device in. So yes, if you've got 2 ears, you do want to be wearing hearing aids. I had a conversation with a client last week where it was, would you say that, if you went to your eye doctor and your eye doctor recommended that you were wearing, you got 2 bad eyes, but we're just going to start you off with a monocle, you probably would think, okay, wait a second, that doesn't make any sense. Well, I've got 2 eyes, why wouldn't I should be wearing glasses. Kind of the same thing with hearing aids, you should be wearing them on both sides if you're able to. Doreen, without my hearing aids, I feel my hearing is worse than before. So, Doreen, that's a pretty common thing, and basically that kind of goes back to the point I made about kind of acoustic enhancement versus sensory deprivation. So when you don't have sound coming in, and I'm kind of the same way. When I take my hearing aids off at night, I would swear that my hearing has actually has dropped. I've had my hearing tested yearly for the last 36 years, and my hearing has stayed pretty constant. When you have the hearing aids in, your brain gets used to that enhancement. It gets used to being able to hear the fridge noise and the furnace noise and the crinkling of paper. And then when all of a sudden you take your hearing aids out, it feels like those sounds have all disappeared. So what your brain is expecting to be able to hear and what it actually can hear is different. So you take the hearing aids out and you're like, geez, I really feel like I'm not hearing as well, or not hearing as well as I was before without them in. That's more of a perception thing. It's not typically a reality unless your hearing is actually dropped, but the chances of that are pretty small. But it's just your brain's expecting to hear something, it doesn't hear it. So your brain is expecting to hear something, it doesn't hear it, so it feels like your hearing has dropped. But again, if you're really concerned about it, it's something to go back in and get your hearing rechecked. But most likely the hearing levels are stable. It's just a perception thing that you're feeling you should be hearing better than you are. So that was number 4. I only need one hearing aid, and hopefully provided the reasons why. Yeah, it's better to go with 2 than it is with 1. Number 5, the last one that I'll kind of go through today. You're welcome, Doreen. Your last one that I'll go through today is my friend got a hearing aid from some other provider. He wore it for a week and he threw it in a drawer. It cost him $5,000, and all his hearing aids are doing are just sitting in a drawer. The hundreds of times, I have heard this, regardless of what clinics I've been in. There's so many variables at play. 2 people with exactly the same hearing loss, with exactly the same hearing aids, can have 2 entirely different experiences, just because of the fact that it's really dependent on how the hearing aid is fit. Who has fit the device? How have they counseled you on the device? The main thing is the hearing aid is one thing, but you can have an awesome hearing aid, or a top of the line hearing aid that's not fit properly, that actually works poorer than an entry-level hearing aid that is fit properly. The main thing is, are the hearing aids being verified on ear? Are you being counseled appropriately? Do you have the right level of technology? That's another big one, where people come in and say, I go to the theater and I like to listen to music and I wear these at the gym and I'm all these in different environments, and then I read out the settings of their hearing aid and I find they have a really entry-level set of devices. Well, if you have a high level of need and you have an entry-level set of devices, those devices are they're not meant for those type of premium environments. So you want to make sure that you get a hearing aid that, again, you want to be budget conscious. You have to certainly keep that in mind, but you want to get a hearing aid that's best suited for your hearing loss, your lifestyle, and your budget. So, and having an expectation of, I have an expectation up here, but I've got kind of entry-level hearing aids. Yeah, they're not going to be able to do everything you want them to be able to do, but you have to decide what's more important to you as kind of the person who's going to be wearing them. Typically, if they're not fit on ear, they're not verified properly, you don't have the right dome attachments, you're not wearing the right design of hearing aid, they're not fit properly, yeah, there's going to be some very issues with making sure that you want to make sure the hearing aids are fit in the proper way. So just because a friend or a relative or somebody who's had a bad experience doesn't necessarily mean you're going to have a bad experience as well too. It's just, it really depends on who's the clinician sitting across from you. Do you believe that this person has your best interest at heart? Are they trying to work with you? It is a two-way street. I counsel appropriately. I have to make sure that the client knows what to do, but it's up for the client themselves to then kind of take care of the hearing aids, wear them properly, adapt to them, and come back in and see me if there's problems. I would rather see you a dozen times in a year to deal with issues than find out a year later you haven't been wearing your hearing aids because of reasons X, Y, and Z. So it can be very important to make sure they're fit properly and you get the right devices for you. Your hearing aids are pretty much I would argue one of the things you would use the most in your environment. So, we don't hesitate to spend whatever money on our car or a TV or a computer or something that we use maybe a couple hours a day. If you're anything like myself where you're wearing hearing aids 16 hours a day, 17 hours a day, it is the appliance or device I use the most in my environment. So if you're going to use it that much, you want to get something that's going to work for you all the time. What question on the Facebook Live? You have very loud tinnitus. Will hearing aids make it go away? So tinnitus is one of those things that we talk to people about frequently. Typically, as hearing loss increases, the perception of the tinnitus will increase. And often what's happening is, as you're not hearing the incoming stimulus from outside of the environment, your brain focuses on the sound that it hears internally. And it can be one ear or both ears. It can be a ringing. It can be a chirping. It can be a buzzing. It could be any number of different sounds. So what I typically do in the environment is, if I've diagnosed that a person has some hearing loss, I will do a demo of hearing aids and I'll put them the hearing aids in. I'll turn them off and I'll have the client go into the sound booth and just kind of tell me their perception of their tinnitus. Then I'll turn the hearing aids on and then I'll ask them the same question. In most of the situations, the people will say, well, yeah, my perception of the tinnitus has decreased a little bit. Because now as you become more auditory aware of the sounds around you, your brain is kind of focused on, here's all the sound I can hear around me. It's focusing less on the sound that it hears inside of the head. Is it going to make the tinnitus go away? Not necessarily. Is it going to necessarily make it go away, but it's going to allow you to kind of retrain your brain to listen to an external stimuli versus an internal stimuli, and hopefully over time you start thinking about it, you start perceiving it less. Tinnitus is one of those things that the more you think about it, the louder it gets. The less you think about it, the quieter it gets. Is it there? Yes. But are hearing aids going to be able to help? Yes. In most situations, and at least in clients I've dealt with, the perception of the tinnitus has been reduced just by having properly fit hearing aids. So that's a great question and definitely something to look into to see if there is loss. If there is loss, get fit. Hearing aids do have the trial period, so if you find that it does work successfully for you to help offset the tinnitus, great, and definitely something to mention to your hearing healthcare provider. There was a question about connecting the TV to the hearing aids. So depending on which manufacturer, sometimes, there's obviously a couple of different cords you do have to plug into the back of the TV. Some TV to hearing aid links have just as soon as you turn the television on, it syncs into the hearing aids. Other companies, such as the Oticon and the ones I'm wearing, I have to press a button in order to get my hearing aid to connect into the TV. I've got an optical cable that plugs into the back of the device and into the TV box. I see a little blue and green light come on. I know that it's working, but if my hearing aid is not in the correct program, I will not be able to hear those extras, that sound come through the TV. So each manufacturer and each television box is slightly different. So the person who did reach out to us, it is something to mention to whomever you got the hearing aids from. Definitely a good idea to check. First of all, check the cables. Check whether or not you've got to turn the device on, not only at the source, but do you have to press the button on the back of your hearing aid? Or a lot of manufacturers are now going to an app-based so you can basically turn them to that into that program and see if that works. All right. Okay. So basically, the 5 things. If I get hearing aids, everyone will notice them. Not necessarily. Only old people wear hearing aids. That's not true. I hear fine. Only my spouse and family says they can't hear. You may or may not be noticing the loss. They definitely are, and it's something to look into. I only need 1 hearing aid. Well, typically 2 is better than 1. It's something we'd like to address. And number 5, my friend got a hearing aid and doesn't like it, so I probably won't either. That's not necessarily the case. A lot of it is really dependent upon who has fit the hearing aid and did you get the hearing aid that was most appropriate for you. You are welcome, Terry. The last thing I'm going to go through as part of my talk today is a couple of different designs of hearing aids. So basically the first design I will show you is the small one. I call it kind of the James Bond of hearing aids. So I'm on my phone, so maybe a little bit difficult to see, but this is essentially basically one of the smallest hearing aids on the market. It's what they call an IIC. So the main thing about this one is that we take a custom impression of the inside of your ear. We make a little mold, and of that mold, we generate a hearing aid from that. What's nice about this one is that it's small, it's inconspicuous, it fits really deep down inside of your ears. For myself, when I'm on the golf course and I want to reduce the effect of the wind noise, this is kind of my go-to hearing aid because it sits deep down inside of the ear. So it's great from a cosmetic standpoint, but from a battery standpoint, not necessarily the greatest. You're looking at about 3 to 4 days that you'd be looking at changing the battery on that device. So you have to decide again what's more important to you. Is it sound quality and cosmetics? Is it battery life? Is it functionality? Is it reliability? That's something that you want to talk to your hearing solutions clinician about. Is that what's important to me? And again, because you always have the ability to trial different devices out, you got the trial period. Go with the one that's your first choice, and if that for whatever reason doesn't work for you, there's always a plan B. I've always got an option for people that I'm sometimes on the fence of whether I think one's going to be better than another. I'll make a recommendation. They'll choose one, knowing that okay, I can try something different, but there's going to be pros and cons to it. So pro, very small, invisible. Basically, no one will know that you're wearing it. Con, yeah, you're changing the battery every few days, and there's really no adjustments, no Bluetooth, nothing like that. Just simple, easy, put it in, take it out. The other one, and probably the most common design of hearing aid, and the one that's probably 90% of what I do, basically it's a little device that looks like this. So this is what they call a receiver and canal hearing aid. So this is what I have on my ear. So there's a little part that goes behind the ear, there's a little connector wire, and then there's a little molded piece that I have. You can either have a little rubber dome on this, or you can have a mold. That's kind of up to your clinician to discuss with you about. The main advantage to these ones, a lot of people say, well, this is certainly much bigger than this, but when you have this hidden behind the ear and you're blessed still to have hair, you're going to have the ability to kind of hide that a little bit more than some of us might. Now, again, people don't see mine, and as you can see, that ship has sailed. So you've got the ability to look at these two different ones. The reason why more and more people are going to these ones is the rechargeability. So because the devices are rechargeable, you don't ever have to worry about batteries. You basically take the hearing aids off, you set them in a little charging receptacle, you take them out, and you put them in. There's no on and off. It's basically simple. It's easy. You put them in, you take them out. These are also Bluetooth enabled. So with my hearing aids, I can answer my cell phone, I can answer my home phone, I can watch my TV, all wireless, all entirely hands-free. So what's great about it is, phone call comes in, just press a button, able to answer the call through both ears, so I'm hearing in stereo. I don't have to worry about picking up my phone. I'm at the gym, I'm out for a walk, I'm doing something where I can just stream music wirelessly. That can all be done in hearing aids this size. It's not going to be able to be done in a hearing aid this size. There's not enough room to put all of those pieces into, but it's still a great product. But they serve different needs and different functions. It's just deciding what works best for you. So rechargeable Bluetooth, a little bit bigger. Sometimes people would argue, yes, it's a little bit more difficult to put this in my ear, but with counseling, with practicing a couple times, it usually does become a lot easier. Both of these hearing aids come in 3 to 4 different levels of technology. So there's what they call an entry level, a mid level, and a premium. Entry level are basically good for entry level environments. I'm home watching TV, I'm in the car with the windows up, and I'm sitting around a dinner table with a couple of people. That's a good entry level hearing aid. Mid-level hearing aid is, from time to time I'm still going out socially. I like to go on the golf course. I'm going to a restaurant with a couple of other people. There's a little bit of background noise. I like to go to the theater. That's a great mid-level. Premium is, if I'm going to do this, I want to get the Cadillac. I want to get the best of the best devices that are out there. I'm going to be moving seamlessly from the golf course to the theater to restaurants to, whenever we're allowed to do all that stuff again. But I'm always in these different environments, and if I'm going to do this, I want to get the absolute best hearing aids that are possible. So there's mainly three different levels of technology. This hearing aid comes in that one, and so does this. if these both took batteries, they're roughly the same overall cost. The rechargeable ones, depending on the manufacturer and depending on a few other factors, there may be a slight upcharge to go to a rechargeable one, but to me, the convenience and the upcharge is definitely worth it. It's negligible to get something that's rechargeable over something that's battery operated. To me, it's just less of a hassle, but it's up for each person to decide. Another good question. So, concerned if you get hearing aids, you're going to lose them. Depending on which design of hearing aid that you get, so if you get something that is behind your ear, they are app-based. So, for example, my hearing aids are hooked into my cell phone, and if I happen to misplace one of my hearing aids, the last time that my hearing aids and my phone talk to each other, I can do a little GPS locate to locate where my hearing aids actually are. It was really effective when I was shoveling my driveway this past winter. One of my hearing aids came off when I was playing outside wrestling with my son. Must have fallen in the snow. I didn't realize it right away. Came back inside. I can't find my hearing aid. Is it inside? Is it outside? I went to the app on my phone and I was able to locate that my phone was my hearing aid was within 10 meters of where I was. So I obviously checked inside, noticed it wasn't out there, went outside of the driveway, and it was actually in the snowbank. So I was able to isolate where it was. So a lot of the newer designs of hearing aids, as long as they've got the Bluetooth and you've got the app on your phone, you can actually locate where the hearing aids are within a reasonable proximity of the last time that the hearing aids and the device is connected. So it is something that's important that, if you're going to get them, can you misplace them? Sure. Can I count how many hearing aids I've misplaced over the course of my life with, 36 years wearing hearing aids? Yeah, a few times. I've definitely lost a few times, like misplaced them a few times. I've never actually ever truly lost a device, but I have misplaced them. Would have been nice to have that technology ages ago, but unfortunately that didn't exist at that time, but it does now, so something to be less concerned about. My take is that every hearing aid always comes with a small carrying case, or it comes with the charger. So if you're not wearing your hearing aids, put them in the charger or put them in the carrying case, and you'll probably find, well, if I lose them, at least if I have a risk of losing them, if you put them in the carrying case or you put them in the charger, you typically always know where they are. So great question. One of my devices picks up hums and buzzes from other electronic devices. Yes, that occasionally can happen. What that often is the culprit is if your hearing aid has what they call a T-coil. So any hearing aids that have a T-coil or a telecoil, what can happen with those is that if it's inadvertently in that program, it can actually pick up an interference from some other electronic devices. So for example, my hearing aids were in the telecoil and I walked by like an ultrasonic machine or the older hearing aids that I used to have that had a T-coil in them, I would trigger the alarms at the bay in the mall. So I'd walk through the mall, my hearing aids would trigger the security gates, and I'd be like, what the heck's going on here? It got to the point where I was shopping there, enough that the people there knew who I was and were like, oh, okay, that was my hearing aids that caused that to go. I was just in the wrong program. So the hearing aid had somehow gotten into that program, or some hearing aids can be automatically programmed to go into that program if it senses some other type of device. You just want to make sure that if you do have a T-coil in your hearing aid, if you want to set it as a manual program versus automatic, it shouldn't pick up those sounds. Because the hearing aids are functioning properly, unless that other electronic device is making a hum or a buzz, you shouldn't hear it any different or anything else. If it really is making a buzzing sound, my suspicion would be that you could be in a T-coil or a telecoil program. So something to look into. If it's still making that sound all the time, something to maybe bring your hearing aids into your hearing care provider and get them to look at it. But that's my suspicion, typically what I would see here. So I hope that was informative. Obviously, if you have any questions, do not hesitate to reach out. I am at the Hearing Solutions in Masonville in London. I hope you found this kind of informative. Again, any questions, let me know. And we'll go from there. Well, thank you everybody for joining in. Great questions, and thanks again. Bye-bye.